Hi everyone. I chose to do the topic of child life and the role that it has in sibling support and helping siblings of hospitalized patients. So, to start off, I want to talk about a few of the common sibling struggles that they face when having um, a family member, sibling hospitalized. They are drastically impacted, right, by their circle of people and surroundings. And so they can experience a lot of different things. They can experience separation from family members. They may be staying at a different family member's house. They may be with family friends. They may be feeling forgotten, may feel less important than the sibling that's hospitalized. A wide variety of feelings: anger, sadness, anxiety, confusion, loneliness. They might have a lot of questions about their siblings' treatment or about the hospital, as well as the burden of extra home responsibilities, which all of these things obviously can attribute and lead to behavior issues, whether that is actually acting out um, or becoming more withdrawn, right? It can lead to trouble in school, trouble sleeping. And then, even here, I put from the research, it can even lead to developmental delays and can cause them to revert back to previous habits, such as thumb sucking, having a security item, and even trouble with toileting. And then, what is sibling support? I loved this definition by Cincinnati Children's on sibling support on their child life page that says to help siblings of various ages understand and cope with the hospitalization of a family member. So, kind of straight to the point. Um, and then, as I was researching, I loved what the ACLP had to say in their report on the value of certified child life specialists. They said a pediatric patient's medical needs have resultant and often substantial impacts on all members of their identified family system. While most research on PMTS, which stands for pediatric medical traumatic stress, focuses on patients and parents slash caregivers, siblings too face adverse developmental and psychosocial consequences as a result of stressful medical events, especially when their unique needs within the family are not addressed. So, as I mentioned, big impact on siblings of hospitalized children, especially this last part, right, when their needs aren't being met, and they feel forgotten or feel like the other sibling um, as being valued more by their parents. And then, how can child life specialists provide sibling support? So, there's a lot of different things. They can teach and help children understand their sibling's diagnosis. So, whether this is preparation beforehand, before even seeing their sibling in the hospital setting, of preparing them to see tubes and machines and beeping and just different things that could go on there. So, to help reduce stress in that way, provide therapeutic play opportunities, including medical play, as shown here in this image. Just kind of helping them better understand, right, and express themselves through play. Teach coping skills, right? Coping of how to handle everything that's going on and things that may happen in the future. Help children connect with their hospitalized sibling, right? They're in a different environment, but to help normalize things as much as possible so they can interact with their sibling and still have those play opportunities if possible. And then, as well as education and support for grief and bereavement. We've talked about this a little bit in a prior presentation of um, providing these remembrance and bereavement rituals for for siblings of patients, as well as educating parents on sibling support. Just kind of letting them know this is what the sibling is feeling or experiencing, and here are some ways that you can help them through this process. So, as I researched this topic, I found that there's a large range of services provided to siblings, and it really depends on the hospital. Some hospitals have limited sibling visitation. Some others have playrooms where siblings can come, and they're staffed by child life or volunteers. Some have playrooms with no supervision, And others provide structured activities and events for siblings to attend in group settings and to get to know other siblings of patients. So there's such a wide range of resources and opportunities for siblings based on the hospital. This is a great video. I won't show it now, but hopefully you can watch it in as part of my presentation. This child life specialist discusses working with siblings and how she provides that extra support and helps build a safe space where they can freely express their opinions and their emotions and really open up to her and ask questions. And then she, in turn, can take the information and collaborate with parents to say, this is what the sibling is feeling, or this is what they're expressing to me. How can we help them, right? How can we make a plan to, best help them cope? And then benefits of sibling support. There's lots of great benefits. Increased knowledge of the sibling's health and treatment. In the prior video, she talks about, um, we all know this, right? Kids pick up on so much. And so a lot of the siblings, as they ask questions and learn about their siblings' health and treatment, they feel more empowered, right? They have less stress and anxiety knowing what's going on a developmental appropriate level, of course. And then decreased levels of stress, anxiety, less behavioral problems. They're more cooperative in helping care for their sibling, especially if their sibling is maybe in the NICU or younger. And then developed coping skills to help in the future as well. In the article, this article by Stosmani, she related this experience that someone shared in the survey that she did of certified child life specialists working with siblings in the NICU that I really loved. She said, the sibling witnessed his sister's respiratory decline as he was visiting his mother in the mother baby unit and watched the baby be whisked away to the NICU, which was traumatic, as the parents described. I utilized our NICU teaching doll to explain the reasons for his breathing issues, as well as all the monitors the baby was hooked up to and why they were necessary. The family was provided with an expressive activity booklet to help familiarize the sibling with the NICU environment, as well as a storybook to promote normalcy and education. The family was extremely appreciative and noted the sibling was much more comfortable visiting his brother in the NICU, as well as talking about the incident. Right, so this was an example of how the sibling of a patient needed that little bit of extra knowledge and support that was provided through medical play and through a booklet, but how that really helped kind of transform his understanding and his experience in the hospital as a sibling of a patient. And then barriers to sibling support, just to name a few, staff availability. Oftentimes, siblings come at sporadic times, depending on how old they are, whether they're in school. So oftentimes they'll come in the evenings or on the weekends when a child life specialist may not necessarily be available, or hours when the playroom might be closed. So that is one of the barriers. Space constraints and funding at hospitals obviously can be a barrier. And then visitation policies, especially that they're changing. For example, COVID drastically affected this, as well as flu season often affects this as well. But to just in conclusion, I think sibling support is such a great resource that we can offer as child life specialists to help these siblings also have a positive hospital experience. And I really enjoyed learning about this. Hopefully, you've learned something as well. Here are my resources, and thank you.